Yo, what up? It's a tip of the week, and today we're going to be discussing treatment planning specifically for single unit implants. So, the first thing you want to do is make sure you have their medical history. You want to ensure that there aren't any contraindications to placing an implant. The next thing I would like to do is evaluate all the imaging that you have. Once that's done, go ahead and have the patient open as big as they can and palpate the area where the patient is desirous of an implant. I believe this is a very important tool because, one, if a patient's not a candidate for an implant and you send them to get a CT, that's unnecessary radiation. Another thing is this: if you send them to get a CT and they're not an implant candidate already, and you could tell by just doing this digital palpation, then it's also unnecessary cost. So you want to do those things to make your patients happy to come back. Another thing that you want to take in consideration is this: determine the height where this implant is going to be placed. Just remember, you want to stay away from any vital structures, and you want to make sure that you are in a position to place it with the amount of width that's present. The next thing you want to take in consideration are opposing teeth. You want to make sure that these opposing teeth aren't too close to this alveolar ridge because it affects restorability. So you want to keep that in mind. The next thing you want to make sure that you give the patient all their options. Some people just aren't candidates for implants, so a partial would probably be a better option for a patient in this nature. Also, when you're thinking about these things, go over the patient's oral hygiene. When you're placing implants, the implant is only as good as the oral hygiene. My focus is for you to smile after surgery. If you like this video, go ahead and go to my YouTube channel and we'll discuss this case specifically at length. Have a good one.